You've lived a remarkable life, built a thriving career, raised a family, navigated life's highs and lows, and carried the weight of responsibility for decades. But there's something no one prepared you for. In your 60-second, 70-second, or beyond, your body might start letting you down in the bedroom. You might find yourself finishing too quickly, sometimes before intimacy even has a chance to deepen, leaving you feeling frustrated, disconnected, or even betrayed by your own body. It's as if the confidence you've built over years of experience is suddenly undermined in one of the most personal aspects of your life. Worst of all, this topic is rarely discussed openly, leaving many men to struggle in silence, wondering if they're alone. You're not. My name is Dr. James Carter, a men's health specialist and urologist with over 30 years of experience helping men just like you address concerns that impact their lives and relationships. If you're grappling with premature ejaculation, PE, later in life, I want you to hear two critical truths. First, this is far more common than you might think, affecting men across all ages. Second, there are real, practical solutions that can help you regain control and confidence. In this comprehensive guide, I'll uncover why premature ejaculation often emerges or worsens as men age, exploring the complex interplay of biological, psychological, and emotional factors driving it. I'll walk you through actionable steps you can start today to reclaim intimacy, share a common mistake that unknowingly makes PE worse, and offer hope through both non-medical and medical solutions. This isn't just about fixing a problem, it's about rediscovering a part of yourself that still deserves to thrive. If this topic resonates with you, please type 1 in the comments below to let me know you're with me on this journey. If it doesn't apply, type 0. Your feedback helps me create content that speaks directly to your needs. I also encourage you to subscribe and turn on notifications for more practical, science-backed solutions tailored to men's health at this stage of life. Let's dive in and address this head-on, starting with understanding what premature ejaculation really is. What is premature ejaculation? As you enter your 60-second or 70-second, you come to expect certain changes. Mornings might feel slower, your hair might thin or gray, and new medications may appear on your nightstand. But one change catches many men off guard when intimacy, once a source of connection and control, starts to feel rushed or out of sync. You might find yourself reaching climax too soon, often before you or your partner are ready, sometimes before the moment has a chance to feel meaningful. This is premature ejaculation, PE, and it's more than just a fleeting inconvenience. It's a condition that can shake your confidence and strain your relationships. Medically, PE is defined as ejaculation that occurs within 1 to 2 minutes of vaginal penetration, consistently, and is accompanied by a sense of lost control and emotional distress. But it's not just about a stopwatch. It's about the frustration of your body not responding the way you expect, the guilt of leaving your partner unsatisfied, or the anxiety of wondering if it will happen again. PE isn't rare. Research indicates that nearly 30% of men experience it at some point in their lives, yet fewer than 10% seek professional help, often due to embarrassment or the belief that it's just part of aging. This silence only compounds the problem, leaving men to navigate feelings of shame or inadequacy alone. There are two main types of PE, and understanding them can help demystify what you're experiencing. Primary PE is lifelong, present since your earliest sexual experiences, often tied to genetic or neurological factors that make your body more sensitive to stimulation. It typically starts in adolescence and persists unless addressed. Secondary PE, more common among older men, develops later in life after years of normal sexual function. You might have had no issues in your 30-second, 40-second, or even 50-second, but changes, whether health-related, stress-induced, or medication-driven, introduce a new pattern of quick ejaculation that feels impossible to break. This type often comes with a cycle of anxiety. The more it happens, the more you worry, which makes it more likely to happen again. Recognizing that PE is a treatable medical condition, not a personal failing, is the first step toward reclaiming control. Why does PE happen in older men? When men come to me and ask, "Why is this happening now?" I hear the deeper questions behind their words. Why, after decades of knowing their bodies, does intimacy suddenly feel unpredictable? Why does something that once felt natural now bring stress or embarrassment? And why didn't anyone warn them this could happen? The truth is, premature ejaculation in older men isn't a random occurrence or a sign of weakness. It's the result of a complex interplay of factors that become more pronounced with age. Let's break them down to understand what's really going on. First, there's the psychological layer. Performance anxiety doesn't disappear as you age. For many, it intensifies. You might worry about health issues, weaker erections, or keeping up with a partner's expectations. These thoughts trigger the sympathetic nervous system, which governs ejaculation, speeding up arousal and making it harder to delay climax. For example, a man in his 72nd might feel pressure to prove he's still virile, and that mental tension can cause his body to rush through intimacy before he's ready. Second, biological changes play a significant role. Testosterone, the hormone tied to sexual desire and timing, naturally declines with age, affecting not just libido, but your ability to control ejaculation. Similarly, serotonin, a brain chemical that regulates mood and sexual function, often decreases in older age or due to medications like antidepressants or blood pressure drugs, disrupting your body's natural rhythm. Physical changes also contribute. As men age, some experience heightened sensitivity in the penis, where even mild stimulation feels overwhelming, leading to quicker ejaculation. Others face challenges with erectile dysfunction, ED, which creates a sense of urgency during sex rushing to climax before losing an erection. Over time, this urgency becomes a habit, reinforcing the cycle of PE. Genetics can also predispose some men to PE, a factor rarely discussed but worth noting if it runs in your family. Lifestyle factors, like chronic stress, poor sleep, or a sedentary routine, further exacerbate these issues by increasing cortisol levels, which disrupt sexual function. These factors, mental, hormonal, physical, and genetic, don't make you less of a man, they make you human. Understanding them opens the door to solutions, because once you know what's driving PE, you're no longer powerless. You can address the root causes rather than just coping with the symptoms. How is PE diagnosed? One of the biggest myths I hear is that if a health issue doesn't show up on a test or scan, it's not real. Many men hesitate to bring up PE, fearing it's trivial or all in their head. I've seen patients sit in my office, visibly uncomfortable, unsure if they're even allowed to raise this concern. When they finally do, it's often phrased like an apology. "I think I'm finishing too fast." My response is always the same. If it's affecting you, it matters. Diagnosing PE isn't about invasive exams or rigid checklists. It starts with a conversation, a safe space to share what you're experiencing. Clinically, we look for 3 signs: ejaculation within 1-2 minutes of penetration on a consistent basis, a lack of control over timing, and emotional distress, such as frustration, embarrassment, or strain in your relationship. The emotional impact is just as critical as the physical timing. For some men, lasting 3-4 minutes feels inadequate if it leaves them or their partner unsatisfied. For others, a minute might not bother them if they feel content. It's not just about duration, it's about how it affects your confidence and connection. Repetition is another factor. If quick ejaculation happens most of the time, not just occasionally, it's a pattern worth addressing. Diagnosis also involves ruling out other issues, like ED, anxiety-driven arousal problems, or mismatched expectations with a partner. This is why speaking up early is crucial. It helps identify whether it's truly PE, a related condition, or a combination of factors. You don't need to minimize your experience or wait for it to get bad enough. If it's bothering you, it's worth exploring with a doctor who can tailor a plan to your unique needs, health, and goals. Non-medical solutions for PE? The good news is that you don't always need medication to see meaningful change. Non-medical approaches can be incredibly effective, especially when you commit to them consistently. These methods empower you to work with your body, not against it, and often leave you feeling stronger and more connected to yourself. Let's start with movement. Many men, in their 60-second or 70-second assume, exercise is no longer worth the effort, but even moderate activity, like 20 minutes of brisk walking, swimming, or light strength training, can make a difference. Exercise improves blood flow, balances the nervous system, and reduces stress, all of which enhance sexual stamina. For example, high-intensity interval training, HIIT, even in short 7-10-minute sessions, strengthens the mind-body connection, helping you recognize and manage the sensations leading to climax. Next, consider your pelvic floor muscles, which support bladder and sexual function. Weak pelvic floor muscles can contribute to PE, but strengthening them through Kegel exercises can transform your control. To do Kegels, contract the muscles you'd use to stop urinating, hold for 3-5 seconds, and release. Repeat for 10 minutes daily. I've had patients in their 70-second report noticeable improvements in confidence and endurance after just a few weeks. Behavioral techniques are also powerful. The start-stop method involves pausing during sexual activity or solo practice when you feel climax approaching, breathing deeply, and resuming once the urge subsides. This trains your body to extend endurance naturally. The squeeze technique, gently pressing the base of the penis just before climax, interrupts the ejaculatory reflex, giving you time to regroup. These methods may feel awkward initially, but with practice, they rewire your body's response to stimulation. Mindfulness and stress management are equally critical. Chronic stress, whether from work, family, or health concerns, amplifies anxiety and accelerates ejaculation. Simple practices like deep breathing, meditation, or even a quiet moment before intimacy can calm your nervous system, helping you stay present. Modern tools, like masturbation training devices designed to simulate intercourse, offer a low-pressure way to practice control. These non-medical approaches don't just delay ejaculation, they rebuild your sense of agency, reduce anxiety, and deepen your connection to intimacy. They remind you that sex is about presence and partnership, not just performance. Medication-based treatments for PE. For some men, lifestyle changes alone aren't enough, and that's okay. Medication, when used thoughtfully under medical guidance, can complement non-medical efforts and provide significant relief. One accessible option is topical anesthetics, such as lidocaine or benzocaine creams or sprays, applied to the penis to reduce sensitivity. These can extend control by dulling intense sensations, but they require careful use to avoid reducing pleasure for you or your partner. Always follow instructions and wipe off excess before intimacy. Another option is selective serotonin reuptake inhibitors, SSRIs, like sertraline or paroxetine, which increase serotonin levels to delay ejaculation. These are typically taken daily and may take weeks to show full effects, with potential side effects like mild nausea or reduced libido. However, many men find the trade-off worthwhile for the restored confidence. For men experiencing both PE and erectile dysfunction, a common combination medications like sildenafil, Viagra, or tadalafil, Cialis, can improve erection quality, reducing the need to rush sex and indirectly helping with PE. In some countries, duloxetine, a short-acting SSRI taken on demand before sex, offers flexibility without daily commitment, though it's not yet available in the US. Medication isn't a one-size-fits-all solution, and side effects or health conditions, for example, heart issues, must be considered. Working with a doctor ensures the right treatment fits your body and lifestyle. Combining medication with behavioral techniques and exercise often yields the best results, creating a holistic approach to lasting change. What you can do today: you don't need to wait for a doctor's appointment or a perfect moment to start addressing PE. Small, intentional steps today can set you on a path to meaningful progress. Begin by observing your body with curiosity, not judgment. During intimacy, notice what triggers the rush to climax specific sensations, thoughts, or pressures. This awareness builds control over time. Commit to 10 minutes of daily pelvic floor exercises, using the Kegel technique described earlier. Consistency is key. Within weeks, you may notice subtle improvements in stamina and confidence. Incorporate light exercise into your routine, like a 20-minute walk or cycling session, to boost circulation and reduce stress, both of which directly impact sexual performance. Address stress head-on. Life in your 60-second or 70-second brings unique pressures, retirement transitions, family responsibilities, or health concerns that can spill into the bedroom. Try a simple mindfulness practice. Before intimacy, take 5 minutes to breathe deeply, focusing on slow inhales and exhales to calm your mind and body. If you suspect sensitivity or hormonal issues, don't hesitate to schedule a doctor's visit. Ask about testosterone levels or topical creams to see if they're appropriate. Most importantly, open up to your partner. Vulnerability is strength. Saying, "I'm struggling with this, and I want us to work through it together," can deepen your connection and reduce anxiety. For example, one patient shared how discussing PE with his wife not only improved their intimacy, but also brought them closer emotionally as they tackled it as a team. Finally, consider journaling your experiences or setting small goals, like practicing the start-stop technique twice a week during solo sessions. These steps may seem modest, but they're powerful. Change doesn't require grand gestures. It's built on consistent, meaningful choices that honor your worth and your right to fulfilling intimacy. Final thoughts. If you've read this far, I want to acknowledge your courage. Facing a challenge like premature ejaculation, especially when it's rarely discussed, takes strength. Most men carry this burden in silence, believing it's a flaw they must endure or that age has closed the door on change. But here's the truth. You are not broken, you are not alone, and you are not beyond help. PE is a real, diagnosable, and treatable condition, whether it's been a lifelong struggle or a recent development. It's not a punchline or a weakness, it's a signal that your body needs attention and you have the power to respond. We've explored what PE is, not just a matter of timing, but a loss of control that impacts your confidence and relationships. We've uncovered its causes, from anxiety and hormonal shifts to physical sensitivity and patterns tied to erectile dysfunction. We've seen that diagnosis is about how PE affects your life, not just meeting a clinical threshold. And most importantly, we've outlined solutions, non-medical tools like exercise, Kegels, and behavioral techniques, as well as medical options like topical creams or SSRIs that put change within your reach. These strategies work best when combined with intention, patience, and self-compassion. You deserve intimacy that feels fulfilling, no matter your age. At 60, 70, or beyond, you are still a man with a right to connection, pleasure, and confidence. The journey may have challenges, but every step, whether it's a new habit, an honest conversation, or a doctor's visit, moves you closer to reclaiming that part of yourself. I've seen men transform their lives by taking these steps, not because they chased perfection, but because they chose progress. One patient, a 8-year-old retiree, shared how starting with Kegels and opening up to his partner not only improved his stamina, but also rekindled a spark in their 40-year marriage. That's what's possible when you act. So here's my invitation. Start today. Pick one action, whether it's a pelvic floor exercise, a walk, or a heartfelt talk with your partner, and let it lead to the next. Forgive your body for its changes and give it the care it deserves in this new chapter. This isn't about decline. It's about redefining what intimacy means for you. Thank you for trusting this conversation, for showing up for yourself, and for believing in the possibility of better. You're worth the effort, and you always have been. If this guide has resonated, type 1 in the comments to share your commitment to this journey. Let's keep moving forward together.